If you've ever gone to your physician and they've ordered blood tests, those blood tests comes into the laboratory. So we're responsible for collection of the samples, processing them, running all of the tests, doing some interpretation, and then reporting those results to your physician.
Almost all of the medical decisions that the physician is making are based on the results that we are providing to the physician.
Ferris is known for this program. Like, we have the best program in the state, and we're really famous for the medical laboratory science program.
You know, people in the laboratory are like medical detectives. All you're given is a tube of blood or some other sample from the patient to diagnose that disease.
I like that it's like a puzzle. It's always you're figuring things out, and you always have to use your brain, and it's stimulating.
Students will learn how to collect blood samples from patients for doing the testing, how to identify organisms that might be present in patient samples to provide treatment if somebody has an infection, how to do blood typing and testing related to transfusions.
Learning how to dilute things, learning how to calculate your actual result is important too, because just because it'll give you a number, you actually have to factor back in what you diluted.
There's a lot of aspects of patient testing laboratory results that are focused on in our program.
They're going to be using a lot of sophisticated instrumentation.
A lot of equipment from hospitals across the state has been donated to our program.
So the students really get a head start at using a lot of that sophisticated instrumentation.
We're very lucky to have a lot of equipment options for students to practice with.
Another thing that we have is we have a simulated laboratory. It's a 10-week course. The students are essentially running a clinical laboratory, gathering the samples, processing them, ordering samples, running all the assays, doing some interpretation, and then reporting those.
I think our teachers are very well versed. They know a lot of information. The teachers are very friendly. They really want you to succeed in life. They want to know that what they're doing is going to help you.
They really take a lot of interest into all of us, and we have a small lab.
My class size I think right now is 14, and we're all pretty close-knit. It's just really nice to know that there are people around me that care about me.
So they actually can work one-on-one with us as well.
There are 3 faculty, and all of us have been practicing medical laboratory professionals in the past. We bring a lot of knowledge into the program, and we teach the students what they're really going to see in a real working laboratory. The demand is great. I can't graduate enough students to fill all of the openings that there are around the state. If you're interested in a career in medical laboratory science, take a tour of a medical laboratory, talk with a medical laboratory professional, come visit. We'll give you a tour of what we have to offer.
It is very rewarding because you have a large impact in patient diagnoses and patient treatment.
I think the best part of my job is when I go into a hospital laboratory, I can see so many of our graduates and how well trained they've been since they've graduated from our program.